Imagine a world in which you could foresee and possibly mitigate the occurrence of diseases that you have inherited or likely to develop. The Strand Center for Genomics and Personalized Medicine is here to turn that into a reality by offering sequencing-based diagnostic services through healthcare establishments in India. We can scan for an individual's genomic information to determine if diseases have been inherited or if there is a likelihood of developing certain diseases in the future, and the drug therapies that might be most effective in curing them.
In a disease such as cancer, where time is of the essence and tissue samples scarce, our genetic tests based on sequencing can screen all the genes at once, thus eliminating the need for repeated individual gene testing. The overall process for testing is fairly simple. The physician requisitions a test for his or her patient at the Strand Center, and we receive the patient sample from the path lab. We then sequence the tissue and analyze the results. Our tests locate harmful mutations or genomic markers that are responsible for uncontrolled tumor growth. For example, in a case of breast cancer, the genomic profile can reveal which tumors are likely to be more aggressive than others by detecting early signatures of malignancy. It can also reveal information regarding targeted or chemotherapies that might work best for a certain cancer type.
The amount of information coming out of these tests is extremely vast and complex. So, analyzing and interpreting this information carefully and correctly is vital to this process. The report is created with our proprietary platform and highlights information that may guide a course of treatment. It carries supporting scientific and medical literature for evaluating potential treatment options. This enables physicians to optimize and personalize treatments by directing targeted therapies which are much more effective and less toxic. At the Strand Center, we have extremely robust computational and intellectual infrastructure to identify and transmit deep genomic insights from the laboratory to the clinic.
For the first time in India, Strand Center is applying genomic research in clinical contexts for the benefits of patients with panels for oncology, cardiology, ophthalmology, monogenic diabetes, as well as exome sequencing for the discovery of rare diseases. With over 200 highly qualified scientists, engineers, clinicians, and counselors, Strand is focused on fundamentally changing the treatment landscape in India by bringing into play computational, scientific, and medical expertise. Our aim is to make genomic tests a part of routine medical care, thereby empowering clinicians to make more informed decisions and offering the patients a shot at personalized therapy.